Joining us now is Kristine Grow. She is a spokesperson for the Coalition for Medicare Choices. That's the acronym CMC, Coalition for Medicare Choices. And this is a national grassroots coalition of more than 2 million seniors and disabled individuals that work year-round to protect individuals enrolled in Medicaid Advantage. Kristine, good to have you with us.
John, thanks very much for having me.
Okay, what is exactly, for our listeners, Medicare Advantage, and what role does it play in the Commonwealth?
Sure. So as you had mentioned, the Coalition for Medicare Choices is a grassroots organization that includes more than 2 million seniors from around the nation who are dedicated to protecting Medicare Advantage. Seniors and others with various disabilities are eligible to sign up for Medicare. When they go to make that choice, they actually have a choice between traditional Medicare or Medicare Advantage plans, which offer additional benefits, additional services, and quite frequently they can be much cheaper, both for the taxpayers as well as those who sign up for the plans.
So tell us the difference between regular Medicare, right? You turn, what is it now, 65 or something? How old are you when you're eligible for a Medicare now?
So you would be eligible when you turn 65,
Right, 65.
And there are various disabilities that also make you eligible for Medicare. So then what happens is you will go to the CMS site, the Centers for Medicare and Medicaid Services, which have plan tools that help you decide what kind of Medicare plan do you want. And if you look at the Medicare Advantage plans, what you'll find is they have a whole lot more benefits, a lot more services available to you. They provide prescription drug coverage for no extra cost in a lot of cases, and they also cap what you need to spend out of your pocket for when you see your doctor.
So now if you sign up for Medicare Advantage instead of just plain Medicare, do you have to spend more money for that, or is it just an eligibility thing?
It depends on what kind of plan you choose, and in a lot of cases you will not be spending more for a Medicare Advantage plan, which is why these seniors are so committed to Medicare Advantage, or what they call MA.
So if you get more benefits, why wouldn't everybody sign up for that?
A lot of people are. We are at the point now where more than 18 million people have signed up for Medicare Advantage. So it's becoming a very popular program, and we've reached the point now that Medicare Advantage actually costs the same as traditional Medicare. So whether you are a senior that's on a Medicare plan or whether you're a taxpayer, it will actually be cheaper for you and better for you in the long run because you have the same kinds of costs, more and better services.
All right, so what you're saying is Medicare Advantage, apples to apples, is better than plain Medicare, but then why would people not, I guess I'm back to the question, why wouldn't everybody just sign up for that?
I think a lot of it has to do with what they know is available to them, and it's a lot of the shopping experience. When people sign up, they look at the various plans, they make their own decisions for themselves. Different kinds of Medicare plans are available depending on the county that you live in, so you'll have different kinds of plans to choose from. And, it's really an option that we want to make available, that the government wants to make available to all people. And it's just great to see that the Medicare Advantage plans, as they've been improved year over year, time after time, that people are seeing more and more value in those plans and are signing up for them in greater numbers.
We're with Kristine Grow. She is the spokesperson for the Coalition for Medicare Choices, CMC. Now, across the country, more than 30% of Medicare beneficiaries choose Medicare Advantage. That includes over 200,000 Virginia residents. So let me just say this. We have a new president, Trump. What changes do you think a Trump administration might make that might affect your Medicare Advantage program?
Well, we're coming up to a very important milestone that will be a very telling indicator of what the president may do. The president has said time and again throughout his campaign and after his election that he's very supportive of Medicare, that he thinks it's very important. February 2nd, we are expecting that CMS will issue its rates notice, which indicates how much it's willing to pay into the program. That will be a good indicator of how much support the administration will continue to provide to Medicare. And seniors are hopeful from what they've heard from the president and his various tours and his various press events. You know, him being supportive is good for is good news for the seniors, and we are hopeful that we're going to see that in action on February 2nd.
Okay, I've got a text here from one of our listeners in Richmond who says, I'm pretty sure Medicaid Advantage is administered by health insurance companies, Medicare, run by the U.S. government. Is that accurate?
Medicare Advantage plans are offered by private insurers, but they're all regulated by the federal government. So the federal government has the rules and regulations that govern the plans. They do the quality reviews. They rate Medicare Advantage by what are called star ratings. So the better the plan is, the more stars you have. So it's a very, very tight-knit kind of program, very carefully regulated, very carefully managed and administrated, which is, part of what gives it the great quality that it has today.
Okay, so just give some facts here, Kristine, to our audience. Medicare Advantage has become really critical for minorities, right? So among minority populations overall, 30% are traditional Medicare versus 23%. 45% of Hispanic Medicare beneficiaries choose Medicare Advantage, and 37% of Medicare Advantage beneficiaries have incomes of under $20,000. And then finally, 55% of Medicare Advantage beneficiaries are women. So interpret these facts. What does all this mean about this program?
It means these various populations, they're shopping around. It can be challenging. Whenever you're signing up for any kind of health plan, it takes some time to get through the information and decide what's best for you. What we see in those numbers are those audiences, those populations are taking the time to think about, what do I want? What does my doctor get? What kind of care do I want to receive? What am I willing to pay? And as they're making that kind of analysis, again and again, as I said, they're coming back to Medicare Advantage as the cheaper, better option that they want to be part of.
What is your organization, what are they looking for Virginia to do as Obamacare unravels now and things of that nature? You've got over 200,000 members in Virginia of Medicaid Advantage. Do you see anything happening, Kristine, at the state level?
Yeah, we are actually active in 30 different states, including the state of Virginia, to let our representatives in Congress know that we need the Medicare Advantage program protected. It's a program that in past years has had very strong support from both sides of the aisle. Last year we had 360 members of Congress send letters of support for the program. We're looking for that kind of support again. We get that kind of support when people call into their representatives and write into their representatives saying that this is important and they would like to see the program continue to be supported. So that's what we're looking for now. Okay,
so you're basically looking for politicians, for government to continue to back Medicare Advantage just over Medicare. Is there a different funding mechanism? Like, is it additional taxpayer dollars? How is some of the cost offset with the added benefits that you have? How does it impact the taxpayer that is not disabled, not a retiree?
Yeah, actually for the taxpayer, it ends up being cheaper, especially with the data that we're getting now. It does show that when the federal government pays into the Medicare Advantage program, it's actually cheaper to support a Medicare Advantage member than it is a traditional Medicare member, especially because they're getting additional support and services so they can stay healthier longer, and because there are a lot of programs where the doctors are working toward value, which means they are looking at, is this method of care going to be best able to help this person get healthy and stay healthy longer. So those are called value-based programs. That's something that's very strong in Medicare Advantage plans that's not available in traditional Medicare plans. So as you had mentioned, the Medicare Advantage program is overseen by the federal government. They look at it every single year to say, is it delivering the value that we want for taxpayers as well as those who are on these plans? And based on that, they decide what level of funding they're willing to put in. We have been, very fortunate that year over year the administration sees that it's delivering tremendous value. This year we're seeing stronger value than ever before. So we are hopeful, and we are asking our representatives to say, yes, this is working. In a time when people are looking at pieces of Obamacare that are troubled, Medicare works, Medicare Advantage works, and those are the kinds of programs that need to be protected.
Okay, so let me ask you this. If a senior is currently on Medicare now, they're just a traditional Medicare recipient, beneficiary recipient, can they switch to Medicare Advantage? Can they go to the office and check it out and get somebody to say, look, you're better off with exactly the same money that's coming out of your Social Security check. You're better off with Medicare Advantage. How does that work?
They can make those decisions. They have to make them during the open enrollment period, which just ended in December. So open enrollment for people to take a look at their plans and decide if they want something else is open from about mid-October until mid-December. That's when you make your decisions. But if you are a senior who is newly eligible for a Medicare program, you can make those decisions now. There's a Medicare plan finder that's on the CMS website that you can check out. Take a look at your different options. It'll ask you various questions to help guide you through the decision-making process. So it's all a pretty easy and intuitive kind of process, and people can always check out what does it offer and what more do I need to know about the programs.
Okay, but they have to wait until they can check it out anytime, but to actually change plans, they would have to wait until open enrollment.
That's right. They would need to wait until open enrollment begins in October.
Final question, Kristine Grow. You're the spokesperson for the Coalition for Medicare Choices, CMC. With all the budget cuts coming down the pike and entitlement, like Social Security is going to be insolvent in 12 years if we don't fix it or do something. What, in your opinion, you're in the business, is the future of Medicare and Medicare Advantage? How is this program maintained in the next 2 decades?
Well, as we think about it, we think there's a lot that can be learned from Medicare Advantage that speaks very strongly to what the future should be. We think that with the additional value that's been shown, the improvements of care, the people who are staying healthier longer, with the programs being cheaper and better, it just bodes well to, these are the kinds of things that should be maintained. They should be grown. If we're going to make changes to the Medicare program, we think that these are a good place to start. To how do we, spread these kinds of benefits to more people who are on Medicare, and even in other parts of healthcare, such as the individual market. How do you take the lessons that we've learned and the benefits that people are seeing on Medicare, and how do you spread them to other parts of the healthcare system so that more people benefit from them?
All right, that makes a lot of sense. So we look forward to your input as we go forward after this debate. I want to thank Kristine Grow for being with us and sharing that with us. She's the spokesperson for the Coalition for Medicare Choices, CMC. This is a national grassroots coalition with over 2 million seniors involved. Kristine, thanks for being with us. Thanks for that update.
Thank you so much for having me.
This is the John Fredericks Radio Network. We'll be back. Stay with us.